Hello, everybody, and welcome. And today I'm very pleased to introduce Dr. Kirsty Harris, who's a consultant clinical psychologist working within the NHS in their mental health services. Welcome, Kirsty.
Hello, thank you.
In our Talk Health Expert interview today, we're going to look at how to cope with living with endometriosis, with an emphasis on compassion-focused therapy, which is what Kirsty learned during her clinical training at Oxford University. And she now applies this method in both her professional work and also in her personal life, as she is a woman living with endometriosis. So, Kirsty, I always do this. I hold up the book and it doesn't work, but I think I've got it
Oh, it did
working.
work.
I really would be interested because it's a very interesting story, because it sounds like you've been absolutely through the mill. And I think for many people like myself who don't, I've heard of endometriosis, don't really know what it means. And having read through your book was absolutely what an eye-opener as to how it changes your life, especially if you are undiagnosed with it.
Yeah, I think that is probably one of the most difficult things. The average wait time for diagnosis is 8 years in the UK to find out what is happening to you. For me, I was 20 years to get a formal diagnosis of endometriosis. And certainly for me growing up, nobody knew what it was. That word didn't enter into the vocabulary. There's a big campaign at the moment with some of the charities supporting people with endometriosis, and it just encourages you to start asking, what could it be endometriosis, asking the question, to the doctors and so on. But for me, that question wasn't getting asked because you didn't know what endometriosis was. The only thing that really got talked about was a problem period or a difficult period. And that was the extent of it. So for a lot of my life, the narrative was I had problems with my periods, but nobody really talked about what those problems were. And the other thing, you go.
No, sorry, I was just going to say, what I thought was very interesting in the book was where you start off very early on and you give basically that timeline from starting when you started menstruating from the age of, I think it was 12, and all the way through. And, you saw those 20 years of all the different things that had happened to you. And to me, that was like, oh my goodness, this is just non-stop.
Yeah. And I think what people forget is that endometriosis is not a period disease, it's a whole body disease. So there was lots of things happening to me through those years that I had no idea were connected to endometriosis. So for example, one of my first symptoms was recurrent urinary tract infections and cystitis, which is sort of when you need to go for a wee all the time but you can't go. So my initial symptoms were connected with my bladder, and some of my initial symptoms. So that sort of moved a lot of focus then onto my bladder, and I had kidney specialists and urologists and things. But actually it was linked to my endometriosis. And some people will have problems with their bowel, they'll have problems with their joints. A big problem for me was pain in my legs and in my knees. When I first went to the doctor about that, I was about 15. So it was growing pains. It was because I wasn't exercising enough. I once was told I was too tall because I'm almost 6 foot. So that was one of the problems, apparently. But nobody was putting these symptoms together because it's an inflammatory condition. So it has an impact across the whole body. And that is also what makes it very, very difficult to manage and can make it very disabling if you have a lot of these symptoms. And some people will have a lot and some people will have very few. I had progressively more as time went on, which is what you see in that timeline in the book.
I mean, one of the things that sort of sticks out from what you're saying is, and I've known for ages, and it has always been quoted, it's 8 years for diagnosis, is that because it is hard to diagnose it, or is it because of lack of knowledge of or awareness from the urologist? So, for example, if you went to a urologist now, do you think that they would possibly think, oh, it could actually be something completely different from what they thought it was about?
I mean, I hope so. I hope if I now went to a urologist with problems with my bladder and with my periods, that they might get the gynecologist and make the link. But you're still often, do need multiple professionals involved with complex cases, because everybody is dealing with a different specialism. But those people all need to come together. And I think for me, what was happening is people weren't coming together. It was all very separate. So the links weren't being made. And in terms of the weight, I think some of it is that a lack of knowledge and awareness, which is where the book comes in, and starting to ask yourself, could it be endometriosis comes in. But also I think some of it is to do with the way that the system is currently set up is not optimal for people with endometriosis to access care and support. There's very few specialist centres across the country. The system's different in different parts of the country. England, Scotland, Wales is different. It also, the wait lists are very long. So obviously post-COVID, gynecology wait lists are the worst impacted since COVID. They've increased the largest amount. So if you are waiting to see a gynecologist, you're now waiting longer than for any other type of specialist. And those wait times are sometimes exceeding, years for people to get seen, which again is very, very difficult if you're living with a condition that is worsening, or condition that's meaning you can't work or you can't live your normal life or whatever it is. So the pandemic has had a huge impact as well. And I think also that depending on your cultural background, your experience of education, where you're coming from, that has an impact on how you talk about your periods and how comfortable you are to do that, and whether you're allowed to do that or not. So my experience was, you didn't really talk about your periods. And if you did, it was to another woman, maybe your mum. But that was it. You certainly didn't go talking to lots of people about it. So you didn't get this information that people get now with the internet and social media, that somebody else is saying, actually, no, that's not what my period is like. Sounds like something is different with yours. So I think there's lots and lots of reasons that contribute to that wait time, and the government have now set a target to try and reduce it by 2025, so hopefully it will begin to come down, but there's lots of complexities, I think.
So to be clear, you are not a specialist, you're not a gynecologist, basically. That's not what you are.
Or a doctor of that sort.
Of that sort, yes. But for you, if we just talk about, to give it an example, if you're happy to do so, just to talk about the main symptoms that you had, and the ones that perhaps it really were the red flags that could have been picked up earlier, looking back now.
So I had longer bleeding than usual. So sometimes I'd be bleeding for 10, 15 days at least. Heavy bleeding that led to anemia, that was very hard to manage and control. Significant pain that meant I was unable to function and unable to engage in my normal life. I had migraine. I had the bladder symptoms, recurrent UTIs, cystitis type experiences. They were the first things that I presented with early. Later on, I also had bowel symptoms, which look a bit like IBS. So they look a bit like irritable bowel, either that you can't go to the toilet or you're going to the toilet very often. The other really significant symptom I had was bloating, where I would bloat to the point of looking quite heavily pregnant. And that was incredibly painful, as much as you know, uncomfortable in that your clothes don't fit and you feel more self-conscious, but also was just could be very, very painful. And I think all of those things together, I would have hoped would have started to ring alarm bells. But the other thing that sometimes happens is perhaps people say, oh, well, it could be this. But unless you're able to have that next bit of specialist care, it isn't diagnosed by a GP, it's diagnosed by a gynecologist and a laparoscopy. That's the gold standard for diagnosis, and that's what you need to know for sure. And again, I had lots of ultrasound scans where they'd tell me nothing was wrong, and lots of blood tests where I was told nothing was wrong, and lots of GP appointments where nothing was wrong. And if you are told nothing is wrong, there is no problem enough, then eventually you begin to think that the problem is you. Because I was told repeatedly that this was normal.
And the reason that I was sort of asking you to say those, to see if, you know, that when obviously hopefully lots of people will hear this, is whether it triggers for them, oh my goodness, this all sounds a bit familiar. And
yeah,
what I found absolutely alarming was actually, you know, the sooner you can get a diagnosis, apart from hopefully relieving your symptoms, but the fact is that you don't go on to cause, you know, irreparable issues with other organs.
and I think if you look in the book, if people do buy the book, there's a list of kind of symptoms, and some people will have them all and some people will only have some. But if you have any concern about your periods, whatever that is, I think you need to go to the GP and to have those conversations and start asking those questions of what could this be. And again, sometimes the symptoms don't, you know, it might be that you've got more bladder symptoms than period symptoms, or you've got more bowel symptoms than period symptoms. But again, getting all those things put together and considered is really important, because endometriosis is a whole body disease and it can be anywhere, and that can have a massive impact on people's lives in terms of how it develops. It's also worth saying that for some people, their endometriosis may be in one place, but it may be quite small, if you like, on a laparoscopy, but it can have a massive impact on their life. And other people can have very widespread endometriosis that would be seen as very severe on a laparoscopy, and they might not even know they had it, because how much endometriosis you have doesn't necessarily correlate to the impact that it's having on your life. And I think that's the other thing that people need to sort of know, is if you are somebody who's at an earlier stage, or perhaps has been told that it's a milder form of endometriosis, again, that doesn't mean that your symptoms are not valid or that you're not experiencing this. And I think, unfortunately, one of the downsides, if you like, of a classification system is that sometimes people feel that they're not as bad as somebody else, but actually everybody's experience matters and needs support.
And it's not a competition.
No.
I think that's also can be a real problem, can't it, with people, is, you know, you're not in a competitive situation and your pain is your pain, and people feel it very differently as well.
And I think we also, people are often very desperate, often very hopeless, often have been going round and round and round in circles. So I think we need people to understand that this is a real thing and it is really significant. And that sometimes I think is really difficult to get people to understand. But one of the things I talk about a lot in the book is it is about that compassion that we give to each other and we give to ourselves, of whatever your experience is, it is valid and it matters, and you need that support, whether your experience is exactly the same as somebody else's or different. If it is distressing to you, then it matters.
Yeah, absolutely. So, and really then sort of moving on, and obviously the whole point of your book is actually coping with endometriosis. So basically, how do you live your day-to-day life. And presumably in your professional work, do you actually talk to a lot of people with endometriosis?
So in my professional work, endometriosis isn't a big part of what I do. I don't work in an endometriosis service or a specialist service. I work in mental health, but I do work with women. So I do see sometimes people who have endometriosis as part of their experience. But it isn't my professional role. It is very much my personal experience and journey. But I do use compassion focused therapy within my professional work. That's my, I'd say, dominant model.
Yeah. So can you explain a bit to us what that is, and then how you then can relate that to living with endometriosis?
Yeah, so compassion focused therapy is a type of psychological treatment that was put together by a Professor Paul Gilbert at the Compassionate Mind Foundation. It's not my therapy, it's one that Paul had put together. And it's been used in a whole range of mental health conditions and also physical health conditions, but particularly targets shame and self-criticism. So when we are being very hard on ourselves, we've got that inner voice that perhaps is very critical of us. Compassion focused therapy is about trying to help us to manage that and to approach that differently and to approach it with compassion. So Paul Gilbert says, and the quoted in the book, that compassion gives us the confidence to descend into our suffering. And I think it is about that, being able to lean into the things that are difficult and being able to cope with them differently rather than perhaps trying to avoid them, which is certainly something that I did for a long time, was just try and keep very, very, very busy, so that I didn't really have to think about it or connect with it in any way. And I would often then just burn out and sort of go into a very what we call a flop response, and then have to start all over again. So the way this psychological approach works is both about giving us an understanding of how our brain works and why it works the way it works, and we call that a tricky brain. We all have these tricky brains that are wired a certain way. And then it also gives us techniques and skills training to try and help us to rebalance that, so that we can, I guess, connect with our distress differently.
Could you give me an example of how that would work?
So the easiest example to think of, which we use a lot when beginning to talk about CFT, is compassion flows in different ways. So compassion can flow from ourselves to other people. It can flow from other people to us, and it can flow from self to self, so we can give it to ourselves. And if we were to just think about sort of the flows of compassion, and I said to you, well, let's imagine you have a friend who's going through a really difficult time. Might be that they're going through something you've been through, it might be something different. And in the book, I use the example of obviously endometriosis, and I use myself. So, you know, somebody who's really struggling with chronic pain, who is exhausted all the time, who's been, you know, struggling to keep their day-to-day life ticking over, is perhaps feeling very sad or stressed or whatever. And if I ask you, what would you say to that person? How would you support your friend or loved one? And you just sort of think about that and think about what you'd say. And then say, if I was to ask you, is that what you would do for yourself? Often the answer is no. I would talk to myself very differently to what I would talk to a friend. And that is that flow of compassion, because what you're offering your friend is a self to other compassion. You're offering them something that is, you know, hopefully very helpful, and it's going to make them feel better and very soothing. Whereas what you're offering yourself perhaps might be more critical. And certainly for me, you know, I might say to my friend, just take a break. What can I do to help you? But for myself, I was saying, you're weak. why do you feel like this? You're the only one that feels like this. Everybody else is coping with their periods. It's only you that isn't. You need to keep going. You need to try harder. You know, it's not good enough, was my kind of what I was saying to myself. But I would have never, and still would never, say that to another person.
So that's a really good example then, isn't it? I think that's a really obvious example when because we can probably all relate to that as well. And we just go, because normally you'd say to yourself, well, get a grip. Don't be so ridiculous, isn't it?
Yeah.
One of the things that I was interested in is when you talk about shame as well.
Yeah, so one of the key things in compassion focused work is it's sometimes about thinking about shame, and shame and stigma and how that kind of plays out. And when I learned about CFT, this model, this really resonated with me, because I think there can be a lot of shame around periods and menstrual cycles. And that certainly was the case for me. It wasn't something that everybody talked about, wasn't something that you learned was okay, really. And we talk about external and internal shame. So external shame is the sense that we get from other people that something about us is kind of not okay, is the easiest way to frame it. And that might be something about the way that we talk or the way that we look or something like that. So like earlier I talked about bloating, like my body shape, my weight would change all the time, and I had very little control over that. And at one stage in my life I went to a slimming group. I wanted to lose some weight, and when you go to those groups, if you have a gain in your weight on that week, then you're sort of asked, well, why have you gained weight? What have you not done? Have you gone off plan? And for me, I often hadn't gone off plan. I'd tried very hard, but my weight fluctuated significantly with my endometriosis and my cycle, and that made it very difficult. So I kind of felt that it wasn't okay for me to be fluctuating like that in my weight. And that external shame then might become very internal. So we then start to feel, oh, I'm not attractive. I can't wear that clothing because people are going to see my bloating, or that isn't okay somehow. And if you look at all the messages that we get from the media around how we look and how we behave and who we are, there's a lot of things out there that I think can make us feel quite ashamed, and a lot of them can show up in endometriosis and periods. Even if you just think about the idea of having blood on your clothing, for most of us that would be mortifying. If we were to walk down the street and people see blood on our trousers, as an example. So I think there's something about how we make sense of that, and that's just obviously in my culture. All cultures are different. That for me did make me feel very ashamed, and I think that had a huge impact on me. And being able to name it as that's what it was, and to decide that perhaps it wasn't right. You know, there's lots of things that we're told are right and perhaps aren't. Just being able to question that a little bit, which in psychological therapy we'd call kind of thought challenging or balancing, just starting to think, do I believe this? Is this right? And make our own choices made a lot of difference for me.
And, you know, for the people that have endometriosis, what do you feel that if you know, by getting your book, what will they gain from reading it?
I hope that they will gain a few things, really. I hope that they'll know they're not alone. That's the biggest thing, that you're not on your own in this. I felt alone for a lot of my journey, and you're not. Also, I hope they'll gain a bit of understanding about psychological therapy. Recent surveys from the APPG showed that 90% of women with endometriosis wanted access to psychological therapy, and it's not offered as standard anywhere in the NHS that I know of. So I hope that the book gives a little bit of access to some psychological thinking and psychological strategies, and you learn about compassion focused therapy through that. And I also hope that people start to learn how to approach themselves differently and how they might connect with compassion for themselves as they go through this journey, and that might help them to make what ultimately are very, very difficult decisions about treatment and lifestyle and disclosure and all the things that come with living with a long-term condition.
Yes, absolutely. I mean, I found it a very easy read, and I thought there was a lot of practical things in there that you could, a number of the sort of the diaries, all the usual sort of, where you write down your trigger factors and various things like that, which we all know we should do, but we just need a bit of encouragement to do it. But it just allows you to see that pattern, doesn't it? So that when you do go to seek help, you can give, the more information you can always give to a healthcare professional, the better outcome, hopefully, it will be, the better they can understand what your issues are.
Yeah, and I think the book is twofold. It's one, enabling you to do that and have those conversations and present that information to somebody. And as you say, it's structured in a way you can literally take a pen if you want and write in it and work your way through it. But it's also for when you go to the appointments where there isn't an answer, or you come away knowing that right now this is the best treatment that's available for you, and it may not control all your symptoms, or it may not be doing exactly what you want it to do, but still being able to give yourself time within that. At the moment, endometriosis is an incurable disease, and it has a lot of comorbidities with it and a lot of other complexities with it. It might be that you're managing other types of disability connected with it, and that is an ongoing process, and I think one where we do need to give ourselves time and compassion and support in whichever way we can, really.
Absolutely. Well, and I'm sure that your book, if people do buy it, will give that support, and also get them thinking about the questions that they don't know, or maybe providing, as you're introducing this compassion focused therapy, for people to think, oh, actually, that might be something that would be really relevant and really helpful to me.
Yeah, and there are references and more information in the book as well that people can go and access and read about.
Yes. Kirsty, thank you so much for your time today. Thank you.
Thank you very much. Thank you.